Hello, I'm Leanne Parkin, a Senior Lecturer in Epidemiology at the University of Otago in Dunedin, New Zealand.
And I'm Jack Dummer, a Senior Lecturer and Physician in Respiratory Medicine, also at the University of Otago.
We and our colleagues undertook a study of patterns of inhaler use in patients with COPD across New Zealand.
There are three classes of long-acting inhaler used in COPD. Long-acting beta-agonists, or LABAs, long-acting muscarinic antagonists, or LAMAs, and inhaled corticosteroid, or ICS. Broadly, international guidelines recommend that if a patient has more than occasional symptoms, they should be prescribed a LABA or a LAMA. If symptoms persist, the alternative bronchodilator should be swapped in or added. If a patient suffers from frequent flare-ups of their disease, an inhaled corticosteroid can be added. Recent studies in several countries have found prescribing practice does not conform to international or national COPD guidelines, but no studies have examined longitudinal patterns of use of these inhalers across an entire country. Why is this work important? Well, a lot of people have COPD. It's important to get the maximum benefit of medications while achieving minimum side effects. And lastly, these inhalers are quite expensive.
We obtained linked national health and pharmaceutical dispensing data from the New Zealand Ministry of Health, and we used these data to identify a cohort of patients with COPD who started taking a LABA and/or a LAMA between 2006 and 2013. As you will see in our paper, we took several steps to summarise the detailed dispensing data into episodes of use of therapeutic regimens. And then we examined the patterns of use of those regimens during follow-up. We found that the most commonly initiated treatment was a LABA with an inhaled corticosteroid. There were complex patterns of therapy. Patients used multiple regimens, and there were periods of non-use, which we describe in detail in our paper. Use of inhaled corticosteroid inhalers was inconsistent with guidelines. ICS monotherapy was common, and there was overuse of ICS in patients with infrequent flare-ups and underuse in patients with frequent flare-ups.
In conclusion, consistent with findings from other countries, treatment of COPD does not appear to align with international guidelines, and more work is needed to explore and address reasons for the discrepancy between guideline recommendations and prescribing practices.
Thank you for watching this video.